Hi guys, this is Kirsten, and today I'm going to be talking to you about hypothyroidism and my experience with it. So, just a disclaimer, I'm going to put this out there. I am not a medical professional. I have no formal training when it comes to this sort of thing. This is just talking to you about what I know and also my experience with hypothyroidism. So basically what hypothyroidism is when your thyroid, which is a gland located in front of your throat, does not produce enough hormones that it needs to. The two main hormones that I'm going to be talking about today is TSH and T3. And basically what they do, basically what the thyroid does is regulate your metabolism. So when it doesn't work right, it's felt throughout your body. So, now that you have the simple definition, let's get into the symptoms. So, I'm just going to be listing the most common symptoms. I have them right here in my handy dandy notebook. Here are the symptoms: fatigue, dry skin, muscle stiffness/weakness, weight gain, forgetfulness, difficulty concentrating, difficulty regulating your body temperature, meaning like if you're really cold when other people are hot or just fine. Chronic constipation, swelling, menstrual irregularities, depression, anxiety, and hair loss. So my experience, I wasn't diagnosed until I was 20. I'm now 22, so I've been on treatment for 2 years. So looking back, now that I've done research and familiarized myself with hypothyroidism, looking back, I can see I've had a lot of hypothyroid symptoms for a long time, for as long as I can remember. The last time I was checked for hypothyroidism, I was 12 years old, and my levels came back completely normal. So between 20 and 12, that's 8 years. 8 years when I could have developed hypothyroidism and I wasn't treated. I can't exactly blame medical professionals because hypothyroidism in kids isn't exactly common. So they didn't know what to look for, and all the symptoms that I notice now could be a number of things, and also they were just so separate and not severe enough for people to just pay attention and connect them together up until I was 20, and the severity of them kind of alerted my doctor that, hey, this is something to pay attention to. The thing that triggered it for me, I think, was a very stressful and personal event in my life. I was in a lot of distress and stress emotionally, physically, during this time, and I think that just kind of brought all the symptoms and all the things to light and just amplified them 1,000 times. So, because of this event, I started to feel psychological symptoms, but since I had kind of felt them previously in my early teens, I pay attention to those first because I had a therapist. I had, all those kind of steps down. So of course that's what I went to be treated for first. And I thought, of course, this very trying time has happened, so of course I'm going to be feeling depressed and anxious and, all the emotional things just bubble up. But it was more than that. It was more than just, just kind of upset about this thing. Looking back on it now, yes, it's upsetting and all that, but it really triggered something in me that was just unproportionately large, and I think that has a lot to do with the hypothyroidism. But anyway, while I was getting treated for that, I started noticing some physical symptoms, specifically 3, which I went to go see a doctor for, which led to my diagnosis. So let me get into those 3 first. Weakness/pain in my legs. And despite the fact that I've always been chunky, I've always been overweight, I have always been able to walk. I've been able to walk miles and miles and just not really be fazed by it. But all of a sudden, it was really, really hard for me to walk, even a couple blocks. One specific time I remember clear as day, Jay and I had decided to go on a walk. It was a walk we've done before, and it was one we're starting to do again because part of treating therapy and anxiety is going and physically making yourself active. That's a suggestion anyway, to kind of, take your mind off of it. So we were going on this walk. It was really simple. It wasn't anything that I couldn't do. It was a couple blocks, 3, 4 at most, and it was so hard for me. It was so excruciating. I remember Jay was just trying to get me up and moving, but I couldn't, so I had to use a cane. I was determined to try, so I used the cane, and I had to take so many breaks. I had to breathe, and it was just so hard to do this thing, and it was so frustrating and so eye-opening that this would happen. So kind of in conjunction with this leg pain, I had 2 other symptoms. I had this feeling in my bone / muscle, that feeling when you have a growth spurt. I was having that, and I was 20, and women in my family stopped growing in their teens. So this was very alarming for me, to suddenly start growing. And also along with that, I started getting these, when you lean on something and your limb falls asleep and it wakes up. I had that in my legs for hours at a time if I was sitting down. If I was just sitting, it would just feel like that. And the only time it would kind of stop is if I would move. But like I said, I couldn't move because of said pain. So it was really frustrating. And kind of similarly, I started getting something with my hands. I started getting carpal tunnel-like symptoms. I couldn't write that well, and I was in class, my leg was jittering, trying to figure out how to calm that down in my hand. It was so hard to take notes. I was trying to take notes, calm my leg, calm my hand, and it was just too much. So I went to the doctor, and I told her this, and she said, well, here's some hand splints, while we wait for your test results. Wear them all day, all night. The only exceptions would be if you go to the bathroom, obviously, and when you take a shower, anything like that. Otherwise, on. So I wore them for weeks, and they did help, but it didn't really get to the cause of it. I mean, I wasn't doing anything that should cause such severe pain in my hands. So I was kind of frustrated with her, but I was like, okay, wait for the blood results. And sure enough, hypothyroid. Hypothyroid, really bad. I don't know the exact number now because I'm looking at my medical record online and it doesn't say. It's basically so big that it just gives you an error. So it was over 100. My TSH level was over 100. So that should indicate how bad mine was. The acceptable range, I think is, let me check my handy dandy notes, is between 0.35 and 4. And they start treating, according to my doctor, at 8. I was at over 100. I don't know how I was functioning. I was just super, oh my god. And I started going on levothyroxine, which is a generic of Synthroid, which is synthetic thyroid hormone. I started off at 75 and I went all the way up to 125, 100, and then I've gone back down as I've lost weight. I assume that's why I've gone down. And I've been very responsive. That's great. I feel wonderful. I feel like $1,000,000, but I kind of want to go see an endocrinologist. My general practitioner didn't. Once she figured out what it was, she gave me medicine, and that was that. I am curious to know why I have it and why I had it so severely and what else I can be doing, because I know that there are some diet things that should go along with that besides, losing weight, specific foods and such that I should stay away from. But I kind of want to talk to a professional, so I'm going to be scheduling that sometime soon, I hope, if I remember. It's just to get more answers and to just definitively, because some of the causes of hypothyroidism, it's rare, but it could be some sort of tumor or just any number of not pleasant things. So I want to get that checked just on the off chance. You can never be too safe. That's where I am in my health right now. So let me get into more of my unusual symptoms that aren't typically associated with hypothyroidism / let me just get more into detail with them in general. I kind of skipped over them because I wanted to just give you the overall picture, but these are the specifics in case you're curious. So, along with those physical symptoms, I started also getting like hair on my chest. Not just a little bit. I've never been like a really hairy person. But I was starting to get really a lot of chest hair. And Jay, being the nice guy that he is, was not like, oh, babe, you're totally fine. Obviously, he's just oblivious to the fact that, yeah, that isn't normal. My breasts started kind of leaking. They've stopped completely since I started taking thyroid medication, but I did go and to my doctor on a separate occasion to be like, hey, this is off. She basically kind of implied that it could be a pituitary tumor and then never spoke to me again. So that's another reason why I'm going to go see an endocrinologist, because she hasn't yet, I've been in treatment for a year, mentioned that. Like, who throws out the word tumor and then just drops it? Like, thank you. You're not going to explain this? You're not going to do any more investigating? That's really concerning. So I'm going to do this. So... and you must be wondering, Kirsten, well, then why didn't you just go see someone prior? I mean, this is a very pressing thing, because I forgot, and that is one of the other symptoms that I suffer with. I have horrible memory now, like really, really bad. Like, I have always been someone that remembers dates, times, color codes, events. That's part of the reason why I have been blessed to be so good at school. Suddenly, it's gone. Suddenly overnight, it's so hard to remember like a test, like a homework assignment that's due in 2 days. It's completely and totally horrible, and that's part of the reason why I started getting into planning and calendars. As you can see here, everywhere. I'm like a note-keeping person now, because I never used to have to, and now I do because I forget all the time. During that episode, I call it the episode. Jay calls it the dark. During that, when it was really, really bad, I can't remember a good portion of that. I can't remember a lot of things. When I say I was really gone, I was really gone. Like, so bad. So I know I'm kind of all over the place because that's why memory is all over. So I'm going mostly through like kind of shattered memories and Jay telling me. I was just like out of it, partially because of the PTSD symptoms. If you're unfamiliar, panic attacks, night terrors, I was having really bad all the time, every time at night. Like, sleeping was just very anxiety ridden. Like most people with hypothyroidism, like, just sleep and sleep and sleep. I was terrified to sleep. I did not want to sleep. I hated sleeping, because I associated that with scaring. And I think because of the trauma I had experienced previously, the psychological symptoms with hypothyroid manifested in the PTSD more than anything. I mean, I was depressed and I was anxious, but it manifested in my trauma, and it was just very terrifying and very not good. I'm stuttering because it's emotional and it's just hard to place. I think the PTSD was so bad that I was kind of hallucinating. I was calling Jay other person's name, and I was just irrational. I was just so gone. So I'm not saying everyone with hypothyroidism has this. I'm not saying everyone with PTSD has this. Obviously, it just coincided with me. It just happened to converge, and because of my life experience, and it was just in case you're happening to have something similar, with additional to the PTSD, you're also having these physical symptoms. Maybe you should go see a doctor and have your blood tested for this. So, in addition to that, I was not really eating that well. I was really cold all the time. I didn't have a sex drive. I was just very hyper emotional. I would go off at the drop of a hat, because before then I had just been a very reserved person, very shoving things down, and I think this just kind of exploded into a hurricane of just insanity. And I am so thankful that the pill, not birth control, but levothyroxine has worked so well for me. I just don't want to be that sick again. I don't want to be so helpless and just no, I never want to be that again. So I will do what I have to. Once I go see an endocrinologist, I will change whatever diet I need to change. I've already started. Like I said, I've lost 30 pounds since then. I want to lose more just because it helps, and I also want to eat more nutritiously. More than anything, I just want to stop eating crap and start eating more nice things because it makes me feel a lot better. So if you guys are interested in anything having to do with this, I'll be happy to answer any questions that you have. And I will update you if anyone's I will just update you, if not for your benefit then for my own. And yeah, hopefully you guys are a little bit more educated. Anyone has anything to say, feel free to contact me. So until next time, I will see you guys later. Bye.